Good morning, everyone. Good morning, everyone. I'm Jen Garrett. I'm the Assistant Deputy Secretary at the Wisconsin Department of Safety and Professional Services. We are, as you know, the agency that administers operations for the State Board of Nursing, and which has a nursing and nurse midwife renewal open right now, again, as you know. Thank you for joining us today. We're having this webinar to cover some common questions and information that is useful for license holders to have as they're renewing. Hopefully it will help you successfully complete your renewal, and if you have colleagues or friends who are also renewing, you can share that information as well. We will be recording this and making it available on our website, so you can go back and watch it, or others can see it later. Right now, I'm going to start by introducing our panel of experts that we have with us today. From our credentialing team, we have Nico Rude, if you can just wave, Terry Trinan, and Lori Smith. They'll be running the program, and I'll just be assisting to keep us on time and on track with our agenda. And as soon as we dive in, they'll be giving you all the information that will be useful for you. I'm going to do a quick tech introduction, and then I'll hand things over to Terry, who's going to run our program today. So all of our participants are muted and off camera. You still can participate with questions by putting them in the chat. Lori and I will be monitoring the chat and posing those questions to Terry and Nico at the end of the program. We are saving that Q&A session to the end, but because we are using the chat to collect questions, you can put your questions in the chat at any time. You do have options of who to pose your questions to. Lori's name is there, my name is there, or everyone. It's best to make sure that you include Lori and me, or everyone, so that Lori and I can both see them to make sure your questions get covered. Again, if you miss something or have colleagues who you think would benefit from this, we will make this, we are recording this session and we'll put it on the website, so it'll be widely available. With that, I'm going to hand things over to Terry, but I'll stick around, and if anybody has questions for me or if I can be of assistance, Terry, just let me know as you work through the agenda. Thanks, everyone. Oh, I forgot one thing, an important thing. Before I do that, forgive me, Terry. I want to thank those of you who have already attempted to renew, and to recognize that so far, nearly a quarter of our nurses have renewed already, and we have more than 100,000 nurses. So that's a lot of you and your colleagues who have already engaged in this process very early on. We've only been in the renewal for a week. We have all told nearly a third of our nurses who have either successfully renewed or begun their renewal process, which is phenomenal. So thank you so much for not waiting to the very end. And thank you for joining us today to gather this information to allow us to help you be as successful as you can be with your renewal. Our goal is to make it as seamless and efficient for you. We don't want to take up too much of your time. And we've invested a lot in our new technology to make that renewal process easier. We know there's still some learning to do, and that's why we're having the session now, a week into the renewal. We've learned a lot in the first week, and that's how we've put our agenda together. So I won't interrupt again. I'll hand it over to Terry now, but I just wanted to acknowledge you and your colleagues for being so engaged in this process.
Good morning, everyone. Thank you so much for joining us. I'm going to share my screen. No, that's not what I wanted to share. That's what I wanted to share. So we're going to walk through the actual renewal for you and cover some of the common issues people are having with their renewal. This is our licensee landing page. It's license.wisconsin or wi.gov. And this is where you log in. So the first time you come to this page, you will go down here to forgot change password. And when you click on that, it's going to bring you to username. And a lot of people make the assumption that this is your email. It is not. It is your username, which we have created for you. It is typically the email we have on file with .dsps at the end. So you would enter your username and add .dsps, and then click change or reset password. From here, you should get an email with a link to it to then create your password. So then when we come back to this front page, you would enter your username, the password you just created, and click sign in. So I'm going to share a few of the common issues that we have seen as far as people having issues logging in and how to resolve them. The first one are people not receiving their password reset email, and it can simply be something as easy as the email ending up in your spam or junk. So that's just a quick, simple check. Kind of like when you call the help desk for your computer and they say, have you turned it on or off? So just give a quick check to your spam, see if it's in there. On occasion it is. The most common reason is the user ID that you are entering and the password the email you're entering are not what we have on file in licensee. Another common issue is really strict cybersecurity that blocks our email from even getting to your application. We have seen that with some healthcare systems, hospital systems. We have seen it with mail in some clinics, but not all. Freighter, again, in some clinics, but not all. And we also commonly see this with Hotmail. But we have also seen it with a few others, Live and MSN, but not all the time. So if you have a Hotmail email address, you will probably not be receiving this email. And unfortunately, the best solution for this situation is for you to change your email to another email provider. Another non-email related reason you might not receive the password reset email is the license didn't migrate to licensee, to our new system. It's still in our legacy system. And that might have happened if you moved out of Wisconsin, for example, or you didn't renew your license in 2022. In which case you need to let us know, and then we will help you out as well. The other reason you might not be able to see it is your account is disabled. And an account can become disabled if two people have the same email address attached to their account. So sometimes spouses or partners will both use the same email address. They both happen to be nurses, and then we can't identify who is who, and therefore they're locked. So you need to contact us and we can get you set up. And occasionally we will have applicants who can successfully log in, but they can't see their license. And this is typically because they have created their own account in addition to the one that we had created for them, and their license is attached to the one that we have created for them. So in all of these situations, the best solution is to create a support ticket to get some help. And I'm going to show you how to do that. So to request support to get help, is you click up here in the top blue banner, request support. And you simply fill in the details. So licensing comes up. I'm going to choose I need assistance with. I'm going to choose login. License type, you can do RN, registered nurse, nurse, or midwife. Subject, unable to log in. And it has my name, and this is my test account, email address, phone number, and then a quick description. We would like you to enter your name, your date of birth, and the last four of your social security. And the reason for this is we have so many people, as Jen said, there's 117,000 nurses renewing right now. It is very likely that someone has the exact same name with the exact same profession. So we want to make sure we are communicating with the right person. So I'm going to say I'm unable to log in. And then I'm going to put my details, my name, my date of birth, and then the last four of my social. And then you just simply click submit. We respond to all support tickets within 10 days. So if you submit something, we will do our very best to get it to you, response to you prior to that, but 10 days is what we are telling our customers. As soon as you submit a support ticket, you will receive a auto-generated email that's going to say, thank you for your message. We're tracking your request in case number. So this is a ticket number or a case number, and it'll be in the email. A member of our customer service team will be in touch, and thank you. So as stated, we will reply within 10 days. We typically do this via email, but if they're depending upon the situation, we can give you a call as well. And then in addition, up here under that request support, click here to create a new ticket, or you can click here and these are all of your tickets you have ever submitted. You can look at the ones that are currently open, the ones that have closed. You can view what you said.
So one thing, just Terry, if I could add to this, first and foremost, I would just say that being as detailed as possible in that description is very helpful. So Terry just went through some of the common issues that people experience when trying to log in. So if you have, a Hotmail account, for instance, or you maybe are sharing an email address with somebody else that is also licensed in the state of Wisconsin, all that information is very helpful to us as we try to diagnose your problem. So please, when you do submit that, the different things that you try to log in, that you checked your spam, that you don't have the same license, that you're not using a Hotmail account. If you've gone through kind of that checklist on your own and you could provide that information to us, it is very helpful for our team in being able to try to figure out what the problem is a lot faster and then get you a response as well in a more efficient manner. So as detailed as you can be in that is helpful to get you an answer as quickly as possible.
Thank you, Nico. He is exactly right. That way you're doing some of the troubleshooting for us right away. The next thing I want to talk about is how to change profile information, such as your name and address. And if you want to change from a single state to multi-state or vice versa. So for that, you click on Amendments, Request for Amendment, and you can choose name change, address change. And if I already had a valid RN or midwife license, I would have the opportunity to select change from multi-state to single state or vice versa. So just to show you, I'm going to click name change and next. And for this, you just enter your new information. Going to change it from Trinan test to Smith test, and then you upload a file. It's really that easy. So you can do your driver's license, marriage certificate, divorce decree, social security card, etc. Make sure it's a good, clear photo or PDF that you have scanned, and then upload it and submit. You can also then request the address change, very similar, very easy. You have to choose which license you are changing your address for. And again, you just fill in your new information and submit, very easy. You are able to also view any of your previous changes you have made. Wisconsin. I'll be in Yemen, whatever. And then you'll be able to see. And you receive an email, and again, you'll get a case number, but then you can see what amendments you have submitted. So it's really great of keeping track of all of your information. And from here, we're going to walk through the actual renewal. Once you are logged in, it's a very, very simple renewal, and it's a simple process. So I'm going to choose Renew My License. And I have my registered nurse. I had this expire yesterday so I could get in, and I'm going to click Renew. On this first page, it is giving you some instructions. It's telling you again how to request support if you have any issues. So it's just your first step. Click Next. Here's some personal information. This is where you can opt out to have your information made public. And this, just remember, your name and your city will always be made available to anybody who were to request a list. But if you click, please do not disclose my street address, my PO box, your personal information that is very specific to you will not be provided to others. This is the attestation page. I would encourage you to read each of these statements closely and then click that you have read them. This is stating that everything you're saying is true. Continuing duty of disclosure. If you have anything that has been incorrect or you have any information you need to inform us, please do so. Changes or convictions with your license or your person, again, you need to notify us. Then the last one is delinquent state taxes. If you have a hold due to owing taxes, you will not be able to renew your license. So I'm not going to click all of them just so you can see what happens. When I click Save and Next, it goes back to the top and it says you need to continue filling these out. So please read all of these. Click the I have read and continue. Now we have declarations. This first part is if you have a social security number, or if you do not have a social security number, we have another form you need to fill out. I have read and understand the legal status above. And then this is important. Since your last renewal or initial relicense this is your first renewal, do you have any pending charges or prior convictions? And or have you violated any federal or state laws or any local ordinances, et cetera, et cetera. You can click I have pending charges, I do not have pending charges. I'm going to click I do not have any pending charges, prior convictions, save and next. And here's the fun part. So here's the survey. I'm going to hold off on that for a moment. Asking your primary state of residence. I'm going to go down and choose Wisconsin. And then are you renewing a single state or a multi-state? I'm going to choose single. And then what is or are your state of current practice? I'm just going to use Wisconsin for now. And then if you're not working, you can choose there. If you are working in a federal facility or military, at the bottom. So I'm going to save and next. This is your supporting documents page. If you clicked yes, that you have prior convictions or pending charges, you need to upload this form. So this is a hyperlink. If you click on it, it'll take you to the link. You can complete the form and upload it here. We do not require you to submit any other documentation. If you submit documentation you don't need, that puts your renewal into a manual renewal, and that can take quite a bit longer. So please only fill out and attach form 2254 if you have any additional, not additional, but any new pending charges. So this is the payment screen. I wanted to, this late fee won't be there for you. It's there because of how I set up my test account. So it's $57. And then there is a $4 fee for the nursing renewal. So your total will be $61. But I wanted to show you this because I didn't do this survey. And down here it says you must finish the survey prior to payment. Please revisit and complete the survey. So from there, you can either use the back arrow or you can click over here to the survey. So the survey, we have partnered with the Department of Workforce Development to help facilitate getting this information for them. They put out a report every year that explains the state of nursing in the state of Wisconsin. So I'm going to click Start the Survey. And the questions are dependent on your previous answer. So if you answer, you could have as many as 85 questions, or you could have as few as 50. So please read this upper information. It starts where you were initially credentialed. I'm going to say US. What year did you obtain your first Wisconsin license? For ease, 2000. Your education. I am just simply gonna go through these fairly quickly. For your most recent degree, did you receive your degree from Wisconsin? I'm gonna say yes. Further education, I don't have any further plans. What is your greatest challenge? I'm gonna say no plans to pursue higher education for this question. Artificial intelligence, are you using it in your primary place of work? I will say yes to get more questions. It's going to ask how you use it. You can check all that apply. And then has AI helped you? COVID-19. Have you ever had or provided direct patient care to people with COVID-19? Yes, it'll ask you where. So it's asking for your primary, so just one. And if you were to choose more than one, it does click to the most recent. Compared to before the pandemic, how would you rate your overall personal or mental health? I'm going to say about the same. Which of the following sources of information do you stay informed about COVID-19? You can check all that apply. Just going to say the government, CDC for right now. And then there's specialization information. You can check all that apply, clinical areas that you have knowledge or experience in for 2 years or more. And then this next question has to do with national board certification. I'm not certified, or you can be certified in, check all that apply in any of these practices. Current employment status, working, I'm going to say I'm working as a nurse, receiving compensation as a nurse. How many hours do you work? Do you have the same job, different job, similar job, different employer than last year? And then if you were working as an RN now or not, then vice versa. I am working as an RN. Last year I was working as an RN. Which of the following factors was the most important in your change of employment? For me, it's not applicable because I said I was a nurse and I'm still a nurse. Which of the following factors best captures the single most important factor in your career? And you can choose whichever best fits you. How much longer do you plan to work? You can choose. Do you have any formal leadership roles? If you don't have one, why not? How many years have you provided direct patient care? If you provide direct patient care, how much longer are you going to do it? Is it your primary position you provide direct patient care? And then here's where you can say if you have more than one position. And many people do have more than one position. Do you hold more than one additional paid position? So I'm going to click yes, just so you can see. Why do you have that? Additional income for me, any student loans. So this is regarding your primary place of work. And this is even if it's unpaid or voluntary. So select the category, only one response. I'm going to say I'm nursing. Do you require an RN license? Yes. I'm going to be a regular employee. And then this, they want to know your zip code. of your primary workplace, so they can determine where there might be a need for additional nurses in your area. And then what county you're in. What is your current employment basis for the primary position? I'm going to say I'm hourly. How many hours do you typically work in a week, I should say. How many weeks did you work, including vacation? How understaffed or overstaffed? Rate your staffing level. I'm going to say understaffed. They would like a ballpark of your earnings. And then, does your compensation include any of the following? These are the fringe benefits. I'm going to say retirement and personal health insurance. How long have I worked here? 5 years. Which of the following best describes your function or employment position role? I'm going to say I'm a nurse executive. What percentage of your time do you provide nursing services electronically? I'm going to say never. The mode of communication you use to provide nursing services, I'm going to say I only use the phone. And then this question, 51, is very long. You can choose one area. Please select only one of the categories below as best describing your primary place of work. So hospital, extended care, ambulatory care, home health, etc., public health, correctional care, other educational institutions, or tribal health. So please select what is closest to what you do. And I'm going to say I'm in extended care, and then you choose one additional subheading. And I'm going to say I'm working in a nursing home. How often do you work remotely? Never. Secondary place of work. I'm going to say yes, just so you can see the same questions again. How does this best describe you? Do you require a license? And then where is this? How many hours do you typically work? And then what kind of money do you make in your secondary position? And then we want to know if you are an advanced practice nurse prescriber. You can check all that apply. I'm going to say I'm a nurse practitioner and I am credentialed as such in the state. And I'm not going to have a specialty. Not applicable, I don't have a specialty. Yes, I'm currently working as one. What population am I working on? I'm going to say gerontology. Do you provide outpatient primary care? Say family. Number of hours you work with direct patients at this location. And then mental health services. I'm going to say I don't do that. We're nearing the end here, folks. Demographic information. What is the year of your birth? Your gender. If you are of Hispanic descent. How would you best describe your racial identity? Are you fluent in another language? So I'm going to say yes. I'm going to say Spanish. And then it's going to ask if you use this second language as part of your work with patients. Then it's going to ask if you, which language, pardon me. And then the next question is if you are a certified medical interpreter. I'm going to say no. Again, looking to see where you are. And then if you reside in Wisconsin, where is your primary residence? So you have the option now. You can start your survey and come back to it. So you can click save for later, or you're going to can click submit. I'm going to click submit so you can see how to finish it. Form submitted successfully. So that should happen. You should see that form submitted successfully and the page should go away and it brings you back here. If for some reason your page doesn't go away, it means there is an error on the page. The page will typically move up or down to wherever you need to change or modify an answer. And then you can go ahead and save it for later or go ahead and submit. So from here, you're on the payment screen. Remember, this is incorrect. There won't be a late fee for you. There will be a nursing survey fee, which is $4, bringing your total to $61. You can click Pay and Submit, and it will bring you to the e-payment system for Wisconsin. You can fill this out.
Before we continue, I just want to emphasize a couple points on the survey. So we do have a lot of people contacting about the survey. That green box that says form submitted successfully is extremely important to see. If you haven't seen that, it means your survey hasn't saved. So please make sure that you do not close out of that window if it's still popped up without checking for errors on your survey. Because if that green box has not appeared, it means that the survey hasn't saved and you won't be able to continue. And if you do close out of it, you'll have to reaccomplish the entire thing, which, as you saw, takes some time. So please make sure you do that, and that it has shown that green box that form submitted successfully. Additionally, some people the screen will gray out and then kind of come back to where you can view it again. If that happens and you haven't seen that green box again, that means that the survey wasn't completed or submitted successfully. The most common cause of that is that a question was answered incorrectly. Primarily, we're seeing if it says to select one and people select multiple, that will not allow the survey to submit, or vice versa. So just make sure you read the questions carefully. Make sure you're asking as the question asks you to do, because that will make sure that the survey can be submitted successfully. So I would just say this: a lot of people. It is a long survey, so understand if you need to save for later and come back. To make sure that you have the time to read each question carefully. But I very much encourage you to do that, because we are seeing some people, if they don't fill it out correctly, will not save, and then they have to go back in and complete it, which takes quite a bit of time. So if you have seen a green box and it's still giving you an error on that last page where it says you haven't submitted the survey, please include that again in your support ticket when you reach out to us with that request support button that Terry mentioned earlier. Please just mention, hey, I did see the green box, or hey, I didn't see the green box. I have read all the questions again. I believe that I've answered them accurately. All those things, again, will help us to try to diagnose your situation and get resolution for you faster. So I just wanted to emphasize some of the key points there on the survey.
Thank you, Nico. We did identify one question where people were able to check 2 things instead of 1, and an error wasn't showing, but they weren't able to submit. We have submitted that to our IT department and they fixed that. But there's always a chance that there could be another issue. If you find something, please let us know. So thank you, Nico. I just went back in to show you that it did submit and my answers have been saved. I cannot make any adjustments from here. Now, if I had clicked save for later, your answers you did finish would be saved, and then you could go ahead and continue. So we're looking for the green box. So when you get to the payment screen, once you hit pay and submit, please print this page to keep for your records. This is your receipt for filling out your nurse renewal. So once you have submitted your license and it has successfully renewed, you will receive an email that says, congratulations, your license has been renewed. And I just wanted to also show you where you can print a wall certificate or a wallet certificate that you can carry with you. Pardon me. I want to check or view my approved licenses. Thank you. So under registered nurse, well, that isn't true because I didn't put in a payment because I'm using a test account. So I will go to my Certified General Appraiser. Go over here to this drop-down caret, and I'm going to view my certificates, and you can download. This is the wallet certificate. And then the wall certificate that you can have in your office or wherever you would like. You can also get a governor signed certificate, which is, you can choose wall certificate fee. And for $10, you can get one where Governor Evers has signed it. Again, click Pay and Submit. So it's fairly easy. It's fairly intuitive once you get in. So that wraps up my formal part of the presentation, and we can answer any questions people may have. Or if other people have things from DSPS, please feel free to provide it.
So Terry, one thing I wondered if you could go back and talk a little bit about the amendments. My
Yes.
understanding is that you don't have to wait for your renewal to submit your amendments. And Lori pointed out to me too, that if you have multiple licenses, right now you still have to submit those documents and make those amendments for each license. Is that correct? Or do you have any clarification?
Yes, so your name change amendment would be for all of your licenses because it would apply to all of them. However, your address change, it is unique to each license. So if you have multiple licenses, sometimes people have more than one license, you would have to select one or the other, and you'd have to do this 2 times. And you can hit next and then fill it out. And then do it again for the next license.
Thank you, Terry. How about phone number changes? If I want to change my phone number or make other changes to my profile, how do I best do those?
Thank you very much. That is an important one. An email change, you can do that by clicking Request Support. I highly encourage you to use an email address that is a personal email address and is an address you will have access to forever. A lot of times, if you use a work email, people are changing jobs, changing careers, employers, and their email changes, and then they no longer have access to that email. So we highly encourage you to use a personal email. And to do that, you would simply fill out a support ticket. And down in the description, you can change your email here. And down in the description, again, do your name, date of birth, last 4 of your social, and your new email address that you would like us to use. Same with phone number, various things like that, other than your address or a name change. Thank you, Lori.
Thank you. I have one more question. What if I don't need my license anymore? I don't intend to renew it. Perhaps I'm retiring. Do I need to notify DSPS that I don't intend on renewing my license?
Great question. No, you do not. So in the state of Wisconsin, there is no retired or inactive status for nurses. So if you are going to move out of state or you are going to retire, you do not need to notify us. You can, but you don't need to let us know that you will no longer be practicing in the state. Your license will expire per usual. And at any point in time during the next 5 years, you can renew your license with a $25 late fee. And if you wait beyond that 5 years, you are still able to renew your license. It's just a bit more involved, almost like an initial application again.
Terry, one of the questions in the chat is about how long it takes for a license to renew, but also asks about the application remaining in draft status. So can you talk a little bit about that, you and or possibly Nico?
Sure. So if you apply and you don't need to attach any additional forms, your license should renew automatically. So you should receive an immediate congratulations, your license has renewed. On the first day that the renewal opened on the 10th of January, we did have a situation where we were notified that some of the individuals who were right on the ball and renewed on that first day, that their license got stuck in a draft status. Our IT department is working on that, and they are figuring out a way to push those licenses through. If you received payment confirmation, you do not need to submit payment again. If you submit payment again, you'll be charged again, and then we will need to do a refund. But those will definitely go through, and once they are pushed through, you will receive that renewal email saying congratulations, you have successfully renewed.
So just to clarify, if my application is currently sitting in draft status and I've paid and it's confirmed that I paid, I don't need to do anything additional, correct?
Nope, you don't need to do anything. Hopefully that situation will be rectified soon, and you will get that email saying you have been renewed. Nico, do you have anything to add, or Lori?
No, I would just say, as Terry said, their IT is actively working on that issue that some users experienced. So ask for your patience on that as they work through that. But I do anticipate it being resolved in the next few days. So if you haven't heard anything by, I would say this, about Wednesday of next week, please feel free to reach out via support ticket again and just let us know, because we do anticipate resolution on that in the next few days. So just ask for your patience. And if you haven't seen anything, please feel free to reach out in about a week or so if you haven't seen a resolution.
Yeah. And as Jen stated in the beginning, this is the largest renewal we have by far. The next largest renewal is cosmetologists, where there are 26,000 of them. More than that have already renewed as far as nurses go. So when you're talking about the volume of 118,000, 125,000 with the other midwives, physician's assistants, and perfusionists who are also renewing now, things are going to happen just due to the sheer volume. So there's always going to be, I think, like a one-off.
And I would just say, framing that volume, it's why it's so important to appreciate everybody being on this call today. Clearly, you're actively involved in your renewal process, but please, as Jen mentioned at the beginning of this, let your friends know, let your colleagues know to get in, try to renew. For many people, it's very quick, just about half an hour, including that survey, to be able to renew and be on their way. But for the people that do run into an issue and need to request support there, we try to respond to those within a matter of days. But obviously, the later that gets in the renewal period, the more urgent that becomes for people. So the earlier people can get in and renew, the better for them to be able to get help if it does come to that point.
Yes. I agree.
So I'm Terry and Nico and Lori. I'm not seeing other questions in the chat. Are there other points that you want to revisit or emphasize?
I get, the one thing I would emphasize is just from a technical perspective on asking for help, just to reiterate, I think a couple of things that were said earlier, but because inevitably people will have things that they need help with. We do try to respond in a matter of days. 10 days is the absolute limit, whereby you should have heard something definitely. And if not, please feel free to call and let us know that you've submitted a case. This is my case number. I've been waiting for this long. But generally it's within a couple of days that you should be hearing something back from somebody on the team. The other thing is just the timing of it all. Again, re-emphasizing that the earlier you can get in there, attempt to renew, the better. If you can get access to your account and you can work through those things, every step you get closer is helpful. So just re-emphasizing getting access into licensing now and starting your renewal will definitely help you to stay on top of things. The other thing is just with payments, Terry mentioned it, but just kind of reiterating some highlights I've said. If you've received a confirmation email, please do not go in and pay again, the next best step is to submit that support request. And just let us know. If it's stuck in draft, there is a known issue right now. If you applied last week, I should say that it isn't happening any longer. But if you paid last week and it's stuck in draft, but have a confirmation email, we are working through that issue right now, so that we're aware of those things. As you work through renewal, again, highlight on the survey, making sure that you've checked every question, that you're answering it correctly as the question is asked. We'll make sure that that form is submitted successfully and that you are able to save the form and move on to complete your renewal. So I would say those are big things as well. The last thing is that support tickets are the most efficient way to get help. So if you are calling, if you're emailing and submitting support tickets, I can almost guarantee you that the support ticket will be answered the most quickly of those three methods, in many cases. And so I encourage you to do that as the most efficient way to get resolution on things. But just appreciate that, we ask that you do give us a little time to respond to those. As you can imagine, with 120,000 people that are renewing right now, there are lots and lots of people reaching out, asking questions and requiring support in that renewal period. But also just for all the 400,000 licensed holders we have throughout the state of Wisconsin that are also asking questions right now. So ask for your patience as we go through that. We will respond in a matter of days, and just keeping that ticket number handy and knowing when you submitted that will be the most efficient way, so that if something does need to be escalated, we can do that based on the ticket that you've already submitted, rather than submitting multiple support tickets on the same issue may actually result in increased delays in responding to you in a timely manner. So, but as Jen mentioned, I think we've seen this so far. Lots of people able to get in and renew. So hopefully this was a helpful exercise for everybody to go through and see this in person. And that's all I got, but I'll turn it over for anybody else that might have some comments.
Well, if Terry or Lori don't have anything further, I think we've concluded our program, so we can wrap up. Thank you for joining us. Again, we'll be putting this on our website, and you can revisit or share with colleagues and friends. Encourage you to do that. Otherwise, have a wonderful day and stay warm and safe.
Thank you.
Thank you.